All right, so anatomical position, when we're normally looking at the heart, it looks like this, right? But it's not straight up and down. It's a little bit canted to the left side predominantly. It also, not only does it do this, it also does this. So when we're looking at a 12 lead, what we're looking at predominantly is that left side of the ventricle, all right? Because that's how the heart lays. It doesn't lay flat, and it doesn't lay straight up and down, where you can see the whole thing. What it does is it turns and it's forward, all right? So we're predominantly looking at the left side of the ventricle, which is why it's important when we run a V4R, if we think we have elevation in our inferior leads, we look here because now it looks at this right side. If we run a posterior EKG, a 15 or an 18, you move the 12 lead to the opposite side to run a 15 or an 18. A 15 is V4R, move 5 and 6 to V8, V9, and we're looking specifically at the right inferior aspect of the heart, okay? So at the top, you've got your two atria, right atria, left atria, right ventricle, left ventricle. You can tell there is a significant difference in thickness and feel between the right side and the left side. As you run down the center of the heart, you've got your aortas up here. Your aorta actually is this one. This is your aorta. We'll see it from the inside. This is your pulmonary vein or pulmonary artery that carries deoxygenated blood from the right side to the lungs. This one here is your pulmonary artery that carries oxygenated blood from the lungs back to the left atria. And we'll show you the veins or the valves on the inside. And then your aorta comes out here and up. You'll see this is one of the vertebral arteries that actually splits and goes up the carotids. When we're looking at culprit vessel, we've talked about this a little, not quite so much in this class, but when we talk about cardiology, you're going to have your left anterior descending, runs down the center. Your left circumflex runs under the left atria. The right coronary artery runs under the right atria and runs down the back. It's actually cut, but it would run right down the back and follow basically that cut. It feeds the posterior part of the heart, okay? So as we dissect the heart, we have a huge blood clot. Huge blood clot. This is the thickness of your right ventricle. It's very thin. But if you'll remember, this is a low pressure system. This doesn't go far. This pumps blood from the heart to the lungs. That's all it does. So it doesn't have to be thick. On the inside, what you have is you have these papillary muscles. All these muscles down here on the bottom. There's some big old clots in there. All these papillary muscles down here on the bottom hold your chordae tendineae. All of these things that are holding up here. All of this stuff that's holding up is your chordae tendineae. These chordae tendineae are actually holding these valves. So this is your tricuspid valve. And if we look at it from the top, by taking the atria off, it's full of clot. It's all papillary muscle.
Look at that monster.
Holy crap.
If you look at it from the top, you can see these chordae tendineae are holding all of these leaflets. That leaflet is the valve. All of these leaflets are your valve. So there's 1, all those strings, those are chordae tendineae. There's or second leaflet of the valve. It's here. There's 1, 2, 3. Right side, tricuspid valve. All of these big, thick tendons, these are your chordae tendineae. All of this stuff is papillary muscle. So what can happen is you can damage papillary muscle in an MI that can cause mitral valve regurgitation. It can damage that papillary muscle where it doesn't hold the valve shut. These chordae tendineae are to keep the ventricle from pushing the valve back into the atria. Okay? Once you get through that part, you're going to find that blood leaves the right atria to the pulmonary artery. That pulmonary artery goes to the lungs for oxygenation. As it comes from the lungs, it goes back through the pulmonary vein, pulmonary vein, which is the only oxygenated vein in the body, right? Into the left atria. Now, the left atria isn't quite as rounded as the right. The right is more rounded, the left is more of a triangle. This area over here has a tendency of creating clots. So your patients with AFib, if they have a right side clot problem, they end up with PE. Left side clot problems from the left atrial appendage end up with strokes. These are the ones that get blood clots into the brain. Right side is lungs, pulmonary embolus. Left side is brain. Yeah, you can keep it. I don't care.
No take backs. That's like. I think maybe that's salad today. I think I'm just gonna skip lunch.
Oh no! If you don't think I'm eating here in a minute, you're mistaken. You can't keep this physique if you don't eat.
So you said this is the left atrium.
So that is the right ventricle
Right.
and right atrium together. There's part of it all together. This is the inside of your left atria. Left atria, as you can tell, has a lot of pockets for blood clots to develop. This side over here, this is your left atrial appendage. That left atrial appendage is what causes clots. They can actually put a Watchman's device in there. It basically creates a rounded surface and takes away that ability to have that left atrial appendage clot factor. And they can decrease stroke by a very large percentage. All right, so there's your left. Left anterior descending. Now we're going to get into our bicuspid valve. Another big ass clot. On the inside here, you can tell this has two. There's one leaflet, two leaflets.
Anybody want this?
Make sure you're not kneeing in blood on me.
I'm worried.
There's your two leaflets, 1 and 2. The thickness of the left ventricle in comparison to the thickness of the right. The right side, left side. So this is the workhorse. All these papillary muscle.
Sorry.
All these chordae tendineae holding your leaflets. If there's damage to those, that's how you get mitral valve and tricuspid valve prolapse, which causes regurgitation, which causes congestive heart failure. All of these things play into effect. If any of this papillary muscle becomes damaged, or some of this chordae tendineae becomes loose, now it causes this to flap. And now it can cause regurgitation up into the left ventricle or left atria or right atria. Last thing, blood goes through the aorta, out of the left ventricle, out into the systemic body. With that being said, the body feeds the heart how? On systole or diastole? When does the body give the heart blood? Diastole. Where your feeder vessels at for the heart?
Your feeder vessels?
Mm-hmm. How do they get their blood? Because, I mean, you can tell it doesn't go through the muscle, right?
Turn of the arch, right? From the back end, feeding the.
So yes, so it's in the aortic arch. The aortic arch itself has the coronary arteries, the left and the right. Trying to get where I can get a hold of the damn thing. So as I dissect this aortic arch, or aorta, what you have is you have your semilunar valves, right? So the pulmonary artery has a semilunar valve, and your aortic artery has a semilunar valve. As the heart squeezes, it forces those valves open. When it forces those valves open, what it does is it actually covers the left and right coronary artery. So the coronary arteries are right here. You can see the coronary artery. There's one, there's the other. That one's got a clot. But the coronary arteries are here. That would feed for this particular, and that's your right coronary, and your left would be over here. It's right there. Feed your left side, left coronary artery into your left main. When those valves pop open, those semilunar valves, it protects the baroreceptors in the heart because it's under a low pressure system, right? You don't need a lot of pressure to feed the heart. So as it forces those open, blood goes up. As diastole happens, those valves fold. Blood drains back down and passively fills the heart. As you can tell, any of these patients that have clots like this can very easily throw thrombolytic clots and occlude those coronary arteries. They occlude those coronary arteries, they have big vessel problems quick. That make sense? You guys have any questions about anything we discussed, covered?